So welcome to this Access Anatomy screencast from the University of Leeds that's going to outline the surface anatomy of the abdomen. So on the screen at the moment we have a drawing of the human torso, and specifically we need to identify a couple of important landmarks. So here we have in the midline the sternum, and we have the right and left clavicles. Here we have the 10th rib, and this shaded region is the costal cartilage. Here we have the umbilicus, we have the pubic symphysis, the two pubic bones. Here we have the inguinal ligament and the anterior superior iliac spine. And just supero-posterior to this, we have the iliac tubercles of the iliac crest. So it's important that we divide the surface of the abdomen into various regions or quadrants, so we know whereabouts to palpate for various diagnoses. So what we can do is we can use two planes and divide the surface of the abdomen into 4 quadrants. So if we use the median plane and draw a line directly down the midline, in line with the umbilicus and the pubic symphysis, then what we have is a plane that separates the abdomen into left and right sides. And this is just your usual median plane. If we then draw a horizontal plane that goes across at the level of the umbilicus, the transumbilical plane, then we can divide the abdomen into 4 quadrants. We have an upper right quadrant, we have an upper left quadrant, we have a lower right quadrant, and a lower left quadrant. So by using the median plane and the transumbilical plane, we can divide the abdomen into these 4 quadrants. If we just get rid of that and now use some more planes, 2 vertical and 2 horizontal, then we can divide the abdomen into 9 regions. So first of all, the 2 vertical planes are going to pass through the midpoint of the clavicle superiorly and the midpoint of the inguinal ligaments inferiorly. And this is the mid-clavicular plane, passing through the midpoint of the clavicle superiorly and the midpoint of the inguinal ligaments inferiorly. This is the mid-clavicular plane. And this separates the abdomen into these 3 strips. If we then draw 2 horizontal planes, the subcostal plane, which is inferior to the costal cartilage of the 10th rib, the subcostal plane, and the transtubercular plane, which goes horizontally across at the level of the iliac tubercles, the transtubercular plane, then we can now see we have our 9 regions. We can call these the right hypochondriac and the left hypochondriac. In between these 2 we have the epigastric. Inferior to the 2 hypochondriac regions we have the right lumbar and the left lumbar. In between the 2 lumbar regions we have the umbilical region. Inferior to the 2 lumbar regions, we can have the right inguinal and the left inguinal. And in between the 2 inguinal regions, we can have the pubic region. It's important that you appreciate which organs are positioned deep to each of these 9 regions.